welcome everyone. As we didn't have a board meeting tonight, it was suggested by Art Basson that we use this opportunity to update the Board of Supervisors on coronavirus. So I took them up on it. We talked in the EOC committee, and we decided to treat this sort of like a panel. And we'd have Jack Mabb brief you, David Harrison, our Emergency Management Director, myself, Rob Lagonia, and Sarah Sterling can sort of give updates, and mainly what we're here to do is answer questions. But so I'd like to lead off with Jack, who can go into some of the statistics and data with you, and then we'll turn it over to David Harrison.
Okay, so on December 31st, we had 1,704 cases. In the 13 days since then, we've added 593. This is Christmas and January surge. These are indoor gatherings, people getting together as families. These are of late, and I understand everybody is COVID tired and mask tired. These are businesses that are disregarding mask wearing and paying the price for it, ending up with half and sometimes more of their staff being out positive. So we have 2,297 positives as of today. Now the good news is, well, it's 44 today. I think it's slightly dropping. So I think maybe we might be past the surge for the holidays. We'll see. It's hard to predict. We have 24 hospitalized. That's not the most we've had hospitalized, but that's still pretty high. Back in even in the spring, we didn't have anywhere near as many hospitalized, and a couple of our people are in intensive care. We got word today of an individual rushed to the hospital in the morning, and before lunchtime, she was on a ventilator. So I think there's some folks out there that are pretty seriously ill. What comes with all of these positives is very high mandatory quarantines, very high active cases. This is a lot of work for the staff here when it comes to contacting them daily. Even just taking a temperature check takes time. I have two contract nurses that are now working with us that come to us from the state health department. They're great. They're terrific. But I need more. I've asked for more from the program of the state. I'm hoping to get up to 6 more, because we can't keep up with this. We can't. The pace is crazy. We are doing 7 days a week, but I've got a full complement of people still back in the CD room making these phone calls because it's just so busy. You've probably heard that we have gotten vaccine. We were one of 4 counties in the state that indicated back in the 3rd week of December that we would start taking vaccine. That week, 12/28, they took us up on it. They gave us 100 doses. We set up our pod at Columbia Green Community College in the gym. We were charged with doing at that first level. We were charged with doing medical people, as well as what they were calling the O agencies. So all of the group homes, the OMH and OPWD and all of those homes, we contacted COARC, we contacted Mental Health Association. We filled that first pod, mostly with those individuals. Our second pod was, we had up to 300. That was a lot of the same people, but we also expanded out to other medical providers, EMS and whatever. We had our third pod this morning. I should say our second pod was, we had 270 doses to administer. We gave out every one of them. Our third pod was this morning. We did 269 individuals. We planned on doing 250, but we did get, as you're probably hearing on the national media, some of these vials are overfilled. So we managed to get 19 more vaccines out of this dose. So we did 269 this morning. We opened up this morning to 1B, which is law enforcement, fire. We're still doing some of the group homes, whatever. So it's kind of a mixed bag. We have another pod tomorrow, same group, more or less. We have another pod on Friday, and that's going to be mostly senior citizens. That's the 300 doses. We'll do 280 and we'll keep a little cushion. So by the end of this week, we'll have given out 1,200 vaccines. So I think that's a real plus for a little county. I'd sure as heck like to give more. What the plus of what we've been doing is we're practiced up. We've got a tremendous group of Serve New York volunteers who are helping us. Great people, people who are vaccinating, people who are just helping with flow facilitation around the pod. It's worked out very well at the college gym, and I would, that's a site that we could certainly stay at if we needed to, well through warm weather when we can take our act outside. On that note, I'll stop for a moment, I guess, and let Matt move it on to Dave, and I'll be available for questions.
Chairman, you're on mute.
See, I following directions. You told everybody to mute. Dave, do you want to give an update, please?
Sure, Chairman. Thank you. I'd like to apologize for not using my video. I live in Spencertown where the broadband is still DSL. It's the only option we have. So if I use video, it tends to freeze. Anyway, emergency management has been in a supportive role ever since this has begun with PPE, hand sanitizer. Recently, over the summer, Rob Lopez on our behalf applied for a loan that the county board of supervisors approved. It was a small loan for PPE so that we could build up a stockpile. It was a matching loan. The county used donated funds to match it. And we have just about completed purchasing PPE so that if we get in a situation like we were in the spring, at least we'll have a little cushion. It's not much, but it'll give us something in between when New York State brings us the very little that they provide us. More recently, I was asked by the chairman and Jack to assist with public information as far as the vaccine goes. They had a good idea, and I think Michael Reardon also was involved with this idea, but to have county employees who volunteer to work their workday on a 6-person phone bank that provides COVID information. We've had volunteers that's been up and running, and thank you to Rick from MIS. They literally did that over the weekend to set up laptop and phone stations. We're looking to get more volunteers. However, right now, people seem happy that they're able to talk to a real person. Also, we've been working with Adam and Kelly Vaccaro on the website for DOH so that people can go on and at least check to see if there's any events in Columbia County. I can tell you from personal knowledge and from some of the other people I've talked to in other counties, our Department of Health is leaps and bounds ahead of where some of the other departments are. Right now, our Department of Health is ready to vaccine large numbers of people if we had the vaccine. They're set up. They have a very good location that they do it at. Their people are trained. They have the volunteers to help with the injections. And the only thing that we need are the vaccine. The very little bit that we've got just goes so fast. And there's been a lot of confusion over that on the state level, as there has been with this whole pandemic. None of us have lived through it before, obviously, but it just seems that the people on the state and federal level who their whole career has been to plan for this, it hasn't worked. But they are adjusting, and we adjust with them. It's been almost daily recently. And right now, the official location is the Columbia County Health Department website for COVID-19 vaccine information. And there's actually a link on there that anyone can click on to see if there are any events coming up. If there's an event there, you can click on that and follow the directions. It'll tell you if there are any openings. I don't believe there are any right now, but you have to keep checking. Um, Other than that, I think I'll just stand by and take any questions if there are any. Thank you.
Thank you, Dave. I do want to say that the reason we ended up with a call center was based on this past weekend and some of the governor's announcements. Our phones and our computer lines were sort of blowing up, and the health department did not have the capacity nor the time to deal with all the phone calls. And I will say, when I came in Monday morning, and the phones were just hooked up, and there were nobody manning the phones at the time. Every phone was ringing continuously, and it did that all day long and then finally we were able to get 6 volunteers, and we're rotating them in to staff the phones, and that's been continuous from questions that they're getting from staff. So there's no way that our health department would have been able to do contact tracing, testing for the virus, giving vaccinations, and everything else they have to do, and to man the phones. And like I said, we had 6 people doing that continuously, and that'll continue probably for the next couple of weeks. So I just, it was something I got to give credit to. Again, MIS, David Harrison, Kelly Beccaro, and Jack, they turned it around in a matter of a day and getting this call center set up. So I want to give them credit for doing a great job. With that, I want to turn it over to Rob Lagonia.
Hello, everyone. Just add some few items that, firstly, the EOC group that we have that meets and discusses right now, we're 3 times a week. That's invaluable. It's a tremendously group of thinkers and great people in that group. And without these meetings, I have to say that it would be very difficult to manage what we're managing. Matt's done a fantastic job. David's done an amazing job. I'm very proud to be a part of that group. So I just wanted to let everybody understand what we're dealing with, which is the information comes at us sometimes 2 or 3 times a day. We weren't even sure that we were going to be doing immunizations. And then when Jack was asked and he said, sure, we could do it. Okay, great. Now we have to figure this out. And so the first task was, where are we going to do this? We were fortunate enough to get the college to allow us to do it. Matt worked very hard to get that. Jack thought that would be the best place. And unless you see, I don't know if anybody here has been immunized, but if you went down, I was there today, and it's quite an operation. It's very impressive. Jack's done an amazing job, and his staff have done an amazing job. But you need a large facility to do that. Cars park out in the parking lot. There's a lineup of people, which was seamless. They call in large groups at a time, up to 12. There's chairs in a hallway. You wait there. You're then called in. There's a little bit of an informational thing where you sit at desks. They tell you what's going to happen, how it's going to go. You then go over, get immunized. You then have to sit for between 15 and 30 minutes based on your questionnaire, and then they exit you out of the building. If you have to go to the bathroom, there's people there to do that. So it's seamless, and we could absolutely do thousands of people in the county. Jack's team are fantastic. So we're not sure if we're going to be able to utilize the college forever. That seems to me the most appropriate place to do it. I just want to thank everybody that's doing this and let everybody here understand that this is a very big task. People like myself who've never been involved in this, obviously it's even a greater task, but I mean, I've come up to speed pretty quickly, and those that are involved have done so as well. But we're very fortunate to have the health department that we have. We're very fortunate that everybody there is willing to just roll up their sleeves. There's been no complaining. There's been no whining. I'm impressed with the whole group. And I spoke to a lot of them today. So I just want to thank everybody that's involved and tell everybody here that if there's any questions, we're happy to answer them. And just to express my appreciation and my thanks to everybody.
Thanks, Rob. And before I introduce Sarah, I just wanted to say that Rob and Sarah, as the chair and the deputy chair of the Health and Human Services, have both jumped in with both feet. When I asked Rob to be chair a year ago, I had no idea, nor did Rob, and I think I'm glad he's still talking with me. So Sarah, do you want to add anything?
Yeah, well, I'll echo everything that, oh, got an echo here. Everything that Rob says, thanks to everybody. And I think one of the great things about David Harrison and all the EMS people is that they plan for these kind of emergencies and train all the time. So this was not, even though this is a once in a lifetime event, they were ready. And I'm just admire all of them so much. Thanks.
Thank you, Sarah. I did ask PJ Keeler to join us, and I thought he could give us a quick update from the EMS perspective.
All right, thanks, Matt. Kind of want to echo what everybody else has said. Basically, EMS, is on the front line of this whole thing. And just to echo what Jack was saying, since January 1st to January 10th, EMS in Columbia County answered close to 70 COVID-related calls in those 10 days. One day alone, there was a dozen calls. What you're seeing on television that's happening in Los Angeles is actually happening here in Columbia County, obviously on a much lower scale. But in my 40 years of EMS, we've talked about pandemics, we've practiced for pandemics, but quite frankly, on the front line, it's taking an extreme toll on our providers, on our EMTs and paramedics at this time. Last week, got an email. It was kind of a report of what happened during the day from one of our very seasoned paramedics, one of our senior paramedics. And he said, and I quote, I've never been so close to burnout in my entire life. It's taken a toll on these people. I need to understand that. The EMS people are faced with long transport times. We're moving patients from one hospital to another. They're faced with working with these patients and getting them to an emergency room. We do this on a regional basis, as you know. We transport to Albany as well. In some instances, we're waiting 2 or 3 hours to offload a patient out of the back of the ambulance into the ER because they don't have room to handle it. And then after that happens, they have to decon the ambulance completely and shower. So some of these EMTs and medics are doing this several times a day, day after day after day. For the first time, we didn't see this in the spring, but for the first time, we're now experiencing some workforce depletion from EMTs and medics that are going into quarantine. They're either positive themselves or having quarantine orders that they can't come back into service. So obviously that's placing a little more stress on our system. But I do want to commend the 911 Center. As you know, the 911 Center is the quarterback for our whole EMS system. Their professionalism has just been unquestionable. They've managed to get ambulances to scenes when we are nearly depleted of ambulances in the county. So it's been stressful for them as well, and I think you just need to understand that. On a positive note, the majority, a very high percentage of all the EMTs and paramedics on the ambulances are vaccinated, and that's due to CMH and the health department. We push that, quite frankly. Some of the agencies are close to 90% vaccinated, so that's a very good thing. So I think that's about all. That's the update. It is continuing. The last couple of days, we've seen a little slack off, and I hate to even say that, Jack. I probably put the hex on it, but we have been flat out, and hopefully there's some light at the end of the tunnel here. The expectation, I believe, in the next couple of weeks is that maybe it should level off a little bit before it dips, and we certainly hope that we see that before we end up in depleted of resources. All right. Thanks, Matt.
Thank you. Before I turn it over to questions, I just wanted to note that from a county perspective, we've been dealing with our workforce issues as well, whether, people have been exposed or quarantined. As you know, we reduced the workforce to 50% in most departments, and it's 25% in DSS because DSS had quite a few people that were quarantined because of contacts. So that's been an ongoing struggle. Every day I seem to get a call about a different department or a different issue. We're dealing with it, but it's, you never know the next day what you're going to wake up to. So we've had, I won't get into other specific departments, but we had one whole office, as you know, a couple of weeks ago that was totally wiped out and all had to work remotely from home because they were exposed. So this is an issue, but we still have to serve the public as well. So.
Chairman, could I just interject for a second?
Yes, sir.
I don't think the fire coordinator was able to be on the panel tonight, but and I don't want to speak for them, but I'll tell you what I know. They jumped on this also very early, and because of their actions and the guidance that was given by the health department and the fire coordinator's office, the spread and how it affected our firefighters was kept very low. The county assisted in purchasing some special filters for their SCBA units and ensured that they had masks and face coverings. And, I can't even imagine also, along with our EMS and our 911, our law enforcement, what would ever happen if, it really went through our volunteer fire service people. And I think our fire coordinator did a good job, along with the other coordinators, to make sure that, that force was still up and running the whole time.
Thank you. So we'll open it up to questions. There's a little prompt at the bottom of the screen that says raise your hand. Why don't we do it that way?
Matt, Kathy, has her hand raised.
I'm sorry?
Kathy Eldridge has her hand raised.
Okay.
Thank you. I have a couple of questions that came up through my town. What are towns doing with their employees? Are they considered essential? Are they non-essential? I know highway department has been declared non-essential. Water and sewer are essential. I don't know about they're considered essential employees, but are they essential in the COVID vaccine essential?
It's a good question. Jack, do you have are they categorized?
They are not at this point in time. They're public employees, but whenever I see any guidance that says public employees, they speak to police, fire, EMS, obviously, in terms of whatever, and then of course teachers. But they don't get that far down in terms of the definition. But I haven't seen any specific mention of them when it comes to the guidance. That doesn't mean that they're not in 1B. But it's just that the information that comes down from the governor's office hasn't included them.
Okay, so that's they're not included. So their best bet would be to go on the website and sign up as able.
Well, I think one thing that they can do is there's a state website called Am I Eligible, and they can go on there and they can go through that, and at the end it will tell them, yes, you're eligible, no, you're not. And so that's an easy way for if somebody wants to do that, just to find out if they're considered essential and that they're eligible. That would be an easy way to find it out.
Okay. All right.
I would say Supervisor Eldridge, running a water and sewer operation like you do, as you know, water and sewer operators are essential. You have to have somebody there every day, and if you lose your staff, it could be very problematic.
Well, we've already had to cut that down. We've already had to cut it down. We did have a positive in that department, so it was kind of tough. And I had read where public service employees, which included water and sewer, but not highway. So I don't know where I don't even remember where I was reading this from, but okay. Now this one's a touchy one, and don't shoot the messenger, please. Older community members that are in their homes, are they going to be vaccinated in their homes, or are they going to need to be brought to the pods?
Why is it so touchy?
There, I just, it's a tough thing. Everybody's so, I just thought that it might be a little touchy with all the work that's being done, and now to add on the fact that they might have to go to homes where people can't get out.
Well, so you use the word they, and it depends on how you define they. We've cast a broad net when it comes to they and the people that are
Okay.
us. And Mr. Killer can speak to this as well. In the Albany area, there's something called community paramedicine that's available in some counties in New York, much more than others, and that has to do with the fact that there's no doctors out in Clinton County or whatever. But we see it as a very positive thing here, the possibility. And once an EMT or paramedic is trained through a state training site, they can give vaccines. And we see it as a very positive thing that we would give vaccines and set up a program with EMS that those folks could go out and vaccinate people in their home.
But I think the day that I'm including are the elderly that aren't able to stand in the lines, like at the college. I've been asked by a couple of elderly people, that I can't stand out there. So I don't know.
We've taken some names down and some contact information of folks who are in the same boat here at the health department. And I think the short answer I would give you is yes. I think we would make every effort to vaccinate in the homes. And I think that we, as more vaccine becomes available and are able to get it out there, I would love to work with EMS to make that happen.
And Jack, I can tell you that on a regional basis, we have submitted that proposal to the state for approval, and hope to hear back very shortly on that.
Okay. I know there are some elderly that are waiting for it to be like at CVS, because at some point CVS said that they were going to be given them. I don't know how that will work in in a small place, because you
Jack,
have
today while I was there was an elderly woman there that needed a wheelchair, and it was provided for her.
Okay.
So who was that provided to her from? Was that from your office, from someone else? How did she get a wheelchair?
We collected wheelchairs from a number of different sources. We brought them to the site.
So Kathy, there were wheelchairs provided for those that needed it.
I
Okay.
heard that. Thanks, guys.
Thank you. Donnell, Supervisor Collins he had his hand up.
Yeah, I know this is maybe a little bit overly ambitious to ask, but do we have the projected capacity to pre-register, the first shot recipients for the booster shot? I mean, because there is a significant difference in the efficacy of just having one versus having both. And we don't want people walking around with false confidence that they're bulletproof after they just received one shot. Can we in any way envision trying to get people that booster?
So I was on a call today with the state health department in regard to this. They are a week before the first batch of folks that got the first shot are due for the second shot on January 30th. The folks that were vaccinated today, it's February 10th. A week before, and this is what we've been told, I don't necessarily hold 100% faith in it, but a week before those dates, we are going to get the second booster shot. What we've done is we provided people at our pods with a link to go on and register themselves through what's called the CDMS system. That's Communicable Disease Management System. That's a state system. And that's the same way they're signing up for the pods now, that they can go on and register for the second shot. And we will be holding pods on January 30th for those people for that first 109 that were vaccinated that day. We'll be holding pods to give them the second shot as long as it's given to us. And that's my only concern, that we might not see the second shot. There has been some talk at the national level about the fact that you don't really, all the vaccine we have so far is the Moderna. The Moderna requires, or you get your second shot 28 days out. We're hearing talk at the national level, well, maybe you don't need the second shot on the 28th day, maybe it could be 3 months. And I think that's about the effort to try to get that first shot in as many people's arms as they can. But we will schedule a pod on the 30th, and we will give the second shot as long as they give them to us.
And the Moderna vaccine, they projected a year's worth of protection for that. That year is with the booster, or is a single, from a
Well,
single shot perspective?
I heard the same story, I think that you heard, and yes, I heard that, but I don't think that they obviously have enough time to actually figure out how long your immunity lasts. And they're talking about a booster that goes beyond the first year. So I think we're all participating in a giant experiment here when it comes to these vaccines.
Yeah.
And we'll see a year from now how they hold up.
All right. Well, thank you, Jack. And thank you, everybody, for all your work on this. We're really grateful.
Okay, Supervisor Leader.
Hi, everybody. First of all, thank you for all the hard work, Jack, and everybody and the team, Matt and everybody, Kelly for coordinating this. Thank you so much. I spent yesterday with trying to help seniors because they don't have the internet. They don't even own a computer or an iPhone. So my landline was coming off the wall. Please come and help me. And I would take their information and do it myself. But unfortunately, they don't even drive. There was a good number of them that don't even drive also. So we have to look. I spoke to Kevin today from Office of the Aging, and a lot of these are my Meals on Wheels people also. And I suggested that maybe we should put in the phone number for this whole thing to the seniors because they're only hearing from the news. We don't want to inundate, but he thought maybe a little memo in every meal when he delivers might help out a lot of them because I couldn't get to everybody yesterday. So that was one of them. So I really am worried about those people that are not able to get out and so forth. So I think the call center is great, but also getting people to know the phone number. And that's what I was doing yesterday, or trying to help them and so forth to sign up. But I didn't get my vaccine yet either. And I'm of age, so I'm not like all you young people. And so I think we're all waiting patiently. But I think if we can think of something else to help with that aspect of it, I don't know what else we can do in that regard.
Well, it was discussed earlier, the possibility of EMTs going to people's homes and giving the shots. So that
would be
that's
perfect.
one strategy.
That would be a great.
The other strategy may be.
I have 4 older ladies right on my street here that I helped out yesterday, but we couldn't get on a site, couldn't get a date. They won't go to SUNY. They don't, they're afraid of going here and there. So that's the other thing, is keeping everybody calm, especially our seniors. And we're talking 80-year-olds, one lady was 90. She said she'll drive, but I was a little skeptical on that one too. So Kevin said that he'll put something out on the meals. We have a very large Meals on Wheels program here in the town. So I thought that might help also. So
Good. Thank you.
Could I just say, we want everybody to be confident that no matter how long it takes, everybody is going to get the vaccine who wants it. I mean, even the governor has said it could be 14 weeks just before we get through the category that we're in now. And I know I've talked to people who have registered to go to a New York State pod, outside of Columbia County, and they apparently have enough vaccine where they can schedule into March. So, I know everybody wants to get it as soon as they can, and we want to get it to them, especially people who are senior citizens, of course, not you, Supervisor. But we want to make sure that everybody knows that they will be vaccinated. Everybody will get it. It just, it depends on how much vaccine we get, dictates how fast we can do it.
Thank you. Supervisor Adams? You're on mute. There you
I'm
go.
trying to unmute him. Okay. So I just want to echo what everybody said. Thank you to for everybody's hard work and efforts to roll this out as efficiently as possible. I get a lot of questions about numbers, so I'm going to ask a few questions, and if we can answer them, that would be great. And if we can't, maybe we can work on getting these answers later. In terms of the hospitals and the urgent care personnel, are they largely vaccinated? Because I understand there've been, and particularly in the hospital, a number of people who've declined to be vaccinated.
So we don't necessarily track those numbers. I know that the hospital they had a small clinic today. They were still vaccinating their staff, and they are not requiring staff to get the vaccination. And yes, even among medical people who, as far as I'm concerned, should know better, there are folks who work at the hospital who don't want to get the vaccine.
Okay, so they're making the vaccine available, but it's not required.
Right, it's not required.
Okay. And in terms of how many vaccines we get, is that one of the things that's changing day to day from the state or week to week?
Yes, week to week at this point. So we have an opportunity to pre-book on Tuesdays, and then they notify us by the end of the week how many we're getting for the following week. I've been disappointed in the number of vaccines they're giving us. I'm trying to be paid. We pre-booked for 1,000 for next week. It's going to be interesting to see how many we get. This past week we pre-booked for 500 and got 300. So I have to tell you that preliminarily I'm hearing that we might get to 300 again for next week, which would be very disappointing. But we have no control over that whatsoever, how much we get.
So it's really hard to predict. I mean, I think someone referred earlier to a 14-week. It might be 14 weeks. We're saying that we have the capacity to do it more quickly, but it's dependent upon the amount of vaccine that's received.
I feel based upon watching the pods, the last 2 pods today included, that we could easily do 2,000 a week at that site in Columbia Green.
Okay. And who determines, is this, it seems that in large measure, this is state controlled. Is it the state that determines if it will move to the drugstores? Because like Patsy, I've had a number of elder residents who do go to the drugstores regularly and whose druggists know them and they would be comfortable in going there, but feel that Hudson is the other side of the world. They couldn't possibly get to Hudson.
So the governor has determined that he wants health departments to concentrate on public employees, fire, police, whatever. He wants pharmacies to concentrate on senior citizens. The issue is that pharmacies aren't really equipped to handle a lot of people coming in. I have a list of pharmacies that we got last night in an email and there are no pharmacies in Columbia County on this list as having received vaccine. There are a handful of pharmacies in the capital region that appear to have gotten about 100 shots, 100 vaccines apiece. But it is the governor's hope that pharmacies would do senior citizens. And I think his thinking is it's convenient, it's easy for them to get in and out of there. I understand that, but I don't know if they're equipped to handle the kind of volume of people that can, especially Columbia County, we're a gray county, if they're equipped to handle the volume.
Okay. And my last question is has come from several parents. Where do children factor into the vaccination process? And they're thinking about getting their kids back to school, getting their kids to go to school safely, summer camp. Where do kids factor into this? So
the two vaccines that we have now, and I reverse the order sometimes, but I think the Pfizer can only be given over 18. I think the Moderna is over 16, or vice versa. I know that the drug companies are in clinical trials now with vaccines with children, try to verify safety and efficacy with children. And, truthfully, based on what I think we know now is children will probably be last in terms of getting the vaccine. But they are studying it right now to determine if they can be given the same shots we're getting.
So the answer to these parents should be that there is no approved vaccine for children as yet. And
Yes.
we'll know more once a vaccine is approved.
Yes,
Thank you very much.
Hey, Jack, this is PJ. For EMS, we have some EMTs that are 17 years old, and they have been directed that they could only get the Pfizer vaccine.
Okay.
Okay.
So it's Pfizer down to 16.
I believe Rick Scalera was next, Chairman.
I'm sorry, Rick Scalera, yes.
All right,
I
thank you.
was on mute again, I'm sorry.
So was I.
There's a lot of feedback from you, Matt. That's why I keep muting you. Sorry.
I appreciate it. Most of my questions have been answered already. Thank you. But Jack, after Friday's pod, are you indicating that all the vaccines that you have on hand will be used
Yes,
as of Friday?
as of Friday, as of the 300. We're using 500 vaccines that were given to us by Columbia Memorial Hospital today and tomorrow, and we got our allotment of 300, which is going to go on Friday.
Okay. And you said that you're pre-booked well into the next batch of anticipated vaccines. How does somebody find out if they actually are on that pre-booking list?
Okay, so when I say pre-booked, we're pre-booking with State Health Department for a vaccine. We're not booking anybody. So this is a good question, and this is a good place for me to describe the process. So I mentioned CDMS before. That we must book people through CDMS. They must be booked through CDMS. This is a state system. So Chuck Kaiser, our preparedness guy, goes in and he creates an event in CDMS. Once he creates an event, it's based, and he has to put in how many vaccines we want to hand out, what's the date, what's the location, what's the time. Once that happens, there's a link that's created. And the link, then we put the link up and people can register through the link. So the CDMS system is designed to book 18 people every 15 minutes. That's what we thought we could do reasonably. And I think that's proven out to be pretty well. So let's say you go into that system, you hit that link and you go into the system, it's going to give you an opportunity. If you want to come at 10 o'clock, you take a shot at 10 o'clock. And if there isn't 18 people in that time block, it'll assign you to that time block. And then if it's working well and it's working perfectly, you're given a ticket to bring to the pod. So individuals have to book through CDMS. We can't make appointments for people. Now, what can happen, as Patsy was talking about, and this is something that Kevin McDonald and I talk about, somebody else can sign somebody up through that. They can go into the link and sign them up, as long as you know all their personal information, or they're sitting right there with you. And Kevin is going to keep track of names and phone numbers that we pass on to them and that the call center passes on to them, where they can sign senior citizens up through that link.
Okay. So it's constant monitoring that CDMS link all the time. That's the only way.
If anybody has ever bought tickets for a concert, a rock concert, or if you heard about it, you see the Rolling Stones, and you know that at 10 o'clock the ticket gate is going to open up. You might have 15 minutes to book a ticket because otherwise it gets booked up, and that's the way this system is set up right now. You have to monitor for that link to know that it's coming, and you have to get in there and get yourself in there.
It's like a PS5, right? Something like that. Okay, thank you, Jack. That explains a lot.
At the call center, that's what we're explaining to all the callers that are coming in, just so you folks know. We're going through the process with each and every one of these people and actually walking them through the process of how to get on the site and how to find the link and everything. So when it comes time, and we tell them to please keep checking the site, because it is like buying concert tickets or a PS5 at Christmas, trying to get on there and get your time in. So that's what we're explaining to the people that call into the call center, just so everyone knows.
Got it. Thank you.
Supervisor Holding.
Hi, guys. Again, thank you to everyone for all your hard work. I've had the privilege of being on 2 of these calls now, and it's really apparent how hard everyone's working, how difficult it is to create a plan when things are constantly changing. So everyone's doing a great job, and thank you very much. I did have a couple clarifying questions. Jack, for the people, so when I went to the website, it said, you know, we're no longer taking pre-registration, so to speak, and you explained it really well with the CDMS, you know, 5th caller to the radio station, you just got to keep calling until you happen to be the 5th caller. But it did say that if people had emailed before January 10th, they were on some list. So how is that list, if somebody did get on that list before January 10th, they don't need to then go to CDMS? You're going to like enter them a few at a time as the pods open. How is that list working?
So one of our secretaries here, out of the kindness of her heart, came to me about a couple of weeks ago and said, look, I'm getting a lot of calls from seniors who don't have a computer and they don't have anybody they can get on there. I'm going to start maintaining a telephone number and a contact email address and whatever, so that when we do start vaccinating to that population, we can let them know. So that list grew to like 500. And there was somebody in the community who posted. So, and I've used this expression, words do matter. So we were taking information down so that we could direct people when the link became available. And somebody in the community created a posting on Facebook that said we were registering people. And that's a different word. We weren't registering people. So what we did was, Oswaldo, who was on the call here, he helped our administrative assistant take a spreadsheet and did a blast fax to all the people that were on the 500 that were on there to tell them that the link was open. So they were able to go in there, and that's Friday's pod is people from that link who were able to get in there and get themselves registered. Now, obviously, 300 that we're doing on Friday is not the 500 that were on the list. But I'm kind of walking a tight wire here because I'm supposed to be concentrating on public employees, but I really want to help senior citizens out too, and I want to see them get their shot. So we're going to try everything we can to help them get to that link and get in there and be competitive for their rock concert tickets and whatever. But I'm supposed to be vaccinating police, and that's what we were doing today and tomorrow, police and fire and some EMS and whatever. So it's a tightrope walk.
So the resident who today told me I'm all set, I'm on the list, and I said, well, did you get a date and time? Not yet. They're going to be in touch. That's a complete misunderstanding. That person still needs to go through the pod link, through CDMA. Could we, Matt, maybe in your next press release, do a clarification of that? Because I've heard from 4 different people, we're all set. We emailed the health department. We're registered, but we don't have a date or time. So I think there's confusion there.
Yes.
Thank you. And then the other question, Jack, that you might not be announcing publicly, do we know what days and times these pods are opening instead of going every hour of every day? Do I know that on Tuesday morning at 9, I need to jump on?
Well, we're tending to, so we pre-book on a Tuesday. We've been getting our vaccine on a Tuesday, the following Tuesday. That seems to be the pattern that's settling in. And what we'll do on Friday is we'll sit down and we'll create the pod. We'll come up with the dates and the times, and we're tending toward the end of the week to try to be safe that we have vaccine. I don't want 300 people signing up for a pod and not have any vaccine. So we have control over when we create. We have control over the dates and the times ourselves. And then we create it, and it's simply a matter. It's probably 15 minutes from making that decision that Chuck can create the event, and the link pops up.
Okay, and it's mostly on Fridays, is what I'm hearing. Friday's the day to be on top of it.
Well, our first 2 pods were Saturdays. This week we're doing Wednesday, Thursday, Friday. I think we'll probably settle into a Thursday.
No, that's not the question.
I mean when Chuck Kaiser is putting that link out.
Yeah, well, no, because we need to give people time to sign up. So if we create it, it may be up this weekend. If we pick
Okay.
it for next week, it might very well be up this weekend.
Okay, but there's not a set day and time that those links go up. It's
Not at this point, no.
okay. My other question is for the elderly that hopefully eventually EMS can go to their homes, this, that, the other. Would it be helpful and could we create something where us as supervisors, we tend to know our residents? And obviously there's some who are through Meals on Wheels, but I have a lot of seniors who are no, thank you. We don't want help. They're not on Meals on Wheels. Office for the Aging may not know about them. Is there a way that we as supervisors could gather, names, phone numbers, contact information, and either get them to Kevin from Office for the Aging or to your department so that if and when we are able to go into homes, we have their names somewhere on a list to start contacting them?
I don't see a reason why you can't start collecting that information. Since Kevin's not on the call, I'd like to volunteer him to get that list.
Okay, great. Thank you very much. And then my last question, I think, is for Matt. Could we potentially include, I get a lot of questions about how many vaccines. When Jack finds out whatever the number we're going to get for the next week is, could that go in your press release for that day? Next week, we're going to get 300 vaccines. Next week, we're going to get 500 vaccines. Could we include that information?
Provided we know, but what I don't want to do is to cause a firestorm of people wanting to get the vaccines when in fact they're not going to be able to because it's sort of been pre-booked. So
right. And it could include but this is next week, or it could be last week we did 500 vaccines. Last week we did 300 vaccines. Last week we did 800 vaccines. Just something so those numbers are going out to people, because you wouldn't believe the number of calls I'm getting from how many vaccines are we doing? How many vaccines are we doing? So even it might work better to say, last week we did this many vaccines. Good job, health department. Last week we did,
Rob, you were gonna.
Yeah, I just think that it's fine if we're going to put out what we've completed, but to start putting out information of what we potentially may get, I think we're going to muddy the waters. If we're putting out information, we need to leave that in the hands of the health department. I don't want to make it more difficult for anybody, but I think if, on Fridays we could say, hey, we did 500 this week, great job, but I think to try to put something out for what we're getting next week until they're in hand, I think that's dangerous.
Okay.
Plus, what we got this week, there were 500 at the hospital
Right.
loaned us, right? So we didn't even know about that until, later. That's something that popped up in our benefit. But I think right now we don't have enough information to be able to tell people with confidence that we're asking for this. They're saying we're going to get this many, and then we actually get it.
I like Supervisor Ligonia's idea of, last week we did this many, but thank you very much. That's all I had for questions.
Okay, I'm going to ask Supervisor Benvenuto next, then followed by Supervisor Metler, then Supervisor Chimides.
Okay, thank you. I just wanted to follow up on what a couple people have said already, but anticipating the people out there, especially the elderly ones who, don't communicate by internet, may not be getting the information. Have we considered just old school mailers at any point to get out information? Just throwing it out there. I don't know if OFA's doing anything like that, but
I think it's a good idea. I mean, if we can get a list together, I like the idea that Supervisor Holtling came up with, that each town, comes together with a list of people who cannot travel and has that list ready. So if we contact them and say, hey, we can either arrange for transportation or, maybe at some point even do a small pod in your town, they have that list ready and they would get the vaccine first. Or if, EMS was involved and they're able to go to a specific area and start giving the vaccine, at homes. If we could do that, and we all agree that that's the way it's going to be done, and we have a list of people, you know, I don't think Office of the Aging actually has a list of people of everybody that lives in the county that's over 65. But each town is pretty much aware of who lives in their town and who may be affected and what people will they should concentrate on.
One way you can get it is through your STAR exemption through your Office of Assessment. I reached out quite a bit through our elderly through that, and there is a list of people. And that's how I really know a lot of my people is through the STAR exemption when they signed up for it. And it does help out. I have quite a few large numbers of seniors, and that's one way I've done it.
Voter registration too. You can get that by age.
And I felt like if we did it through the towns, that would take a little of the work and onus off the county, right? Like each of us work to gather that information.
I agree. And then we can work with the town supervisor to arrange, vaccines for that group. And you already have the contact information and know how many. I think it would move along a lot faster. It'd be more efficient.
You're muted again, Chairman.
Mike, do you have anything else?
No, I just wanted to, bring that up possibly. Sometimes you have to go old schools.
Thank you. Supervisor Metler.
So first of all, thank you to everyone who's worked so hard on this. As I'm listening though, I'm really, like for instance, everybody keeps talking about CDMS. I don't know what CDMS is. So I feel like there's, everybody else is talking at this level up here, and I'm really down in the grass down here in the nuts and bolts. I'm not, tomorrow night I have a town board meeting and I want to be able to explain to people like in bullet points, this is what you do. You go here, you sign up, you check. Listen, I'll confess, this is confessions now. I've never gotten tickets for a rock concert online. So when you guys keep saying that, like that doesn't ring any bells with me. And a lot of us out here in Copiac, I don't know that they're going to know if I were to say that. So it would really help. Like we got an email the other day from Kelly that kind of spelled it out. Like, they go here, do this, check that. It would really help, I think, if there was a really concise point by point, bullet points map of how to navigate this. It would help me. I'm over 65. It would help me to understand so that I could explain it to other people. Because so far, I'm not real clear on what I'm going to say to people tomorrow night at our Zoom meeting. I'm also thinking that as people come to town hall to pay their taxes, we have a window where they can come and stand outside the town hall and pay their taxes. If I had a sheet that we could hand out to people as they came up to town hall, that would be a really good thing. But so far, I'm not really clear, but I'm going to reach out to Kelly tomorrow because she's going to help me write my remarks for tomorrow night. But anyway, those are just my thoughts. So somebody tell me, what does CDMS mean? And do I sign up on the I'm confused. Do I sign up on the Columbia Department of Health, or do I sign up on New York State, or do I sign up on CDMS? Okay, now you all know that how confused I am.
Okay, so you sign up on the Columbia County Department of Health's website.
Okay.
And you're going to click on a link. And the reason why you at least need to know the initials CDMS is it's going to take you to CDMS.
Okay.
And so I think it would be important for people to know that there's a system there that they're kind of logging in there, so that and if they and I've not been on it, so I don't know what it looks like. Just know that there's a system they're logging on, and it's a statewide system for registering people.
Is it a New York State? Is it a New York State system?
Yes.
And they
Yeah,
look
I-
they
I have
look
actually
exactly the
been on
same,
it.
Jeannie. They
I
look
have
exactly the same. I've registered people on the county site and on the state site. It's the same link. All you have to do is click on the link and follow the prompts, and it'll take
Yes,
you straight through it.
I've gone to the Department of Health page. So if I tell people to follow that link, although they're not aware of it, it's taking them to the CDMS link. Okay.
Yes, Jeannie, I think the CDMS is confusing because the link will be provided like we've been providing other links. It will automatically take you to CDMS. So you're not looking for CDMS, which I think is confusing. You're just looking for the link that we will provide, which will take you to CDMS. And I will tell you that all of the websites that it takes you to are very easy to navigate through. So once you just click on that link, that's all you really have to tell your constituents. There will be a link provided by the health department. Click on that, and that will take you to where you need to go.
So really the person has to be proactive though, right? Because the onus is on the person to go every day and check to see.
Yes.
And when do we think that we will get more vaccines? When will it open up so that people will know that they can get a vaccine within 7 days? Do we know?
We don't know, and I think that what I'm hearing when I listen to the national stuff is that the manufacturers aren't producing it at the rate that they thought they could, and that's been the holdup. And that's there's 20,000 doses that come down to the capital region, which includes 8 counties. There's 20,000 doses, so it's very limited, and we are going to get a little surge. I will tell you, President Biden has indicated he's going to release the reserves that's 55 million doses. If you do the math, 55 million will do 1 in 6 people. And if you look at 1 in 6 for Columbia County, we're going to get thousands of doses. If they do it in equitable, population wise, we're going to get a surge. And I think that's going to help out a lot. But once that surge kind of runs past, it's really up to the manufacturers to keep up with what's going on. And they haven't been. So the short answer is we don't know when. I would create 5 events Monday through Friday and let people pick a day and drop their name in there if I had the vaccine.
Okay, thank you so much.
I also think, Jeannie, the issue with releasing them, which I think is terrific, but it also creates another panic because people are nervous that they won't get the second portion of this. If we put it in a lot more arms, then what happens with the second dose? And that creates some other panics that we're dealing with. Hopefully the manufacturing will catch up. There are 2 other, which we haven't been approved yet, Jack, correct? AstraZeneca and Johnson & Johnson. Those are one-shot deals, which frankly, I'm hoping those come out as soon as possible. But they haven't been approved yet. But once they come out, then it's only 1 shot, which will alleviate a lot of these issues.
And so when we called the CMH and our doctor said, we'll get back to you as soon as we have the vaccination, that was really a false hope, right? In other words, it's going to, in Columbia County, we're not talking about drugstores. We're not talking about doctor's offices. We're really talking for the foreseeable future with the Department of Health.
Well,
is that correct?
I don't think we know the answer to that, Jack. Isn't that fair? I mean, it's changing so rapidly. I for the foreseeable future, for sure, but I don't know about a week from now. It could change. I mean, we don't know.
Okay.
It does change daily, but I think within the week, I would say this: pharmacies, especially chain pharmacies, are probably going to have the vaccine.
Within the week?
Probably within the week, because the governor wants them doing senior citizens.
And so we're talking about chain pharmacies in Columbia County.
Yes, he wants them to have they may only get 50 doses. They may not be able to do that many people, but the governor is pushing for that to happen. So I would say that and he wants them to do seniors. My advice to seniors is, check back with your pharmacy every couple of days to see if they've gotten any doses.
Okay.
Okay, thank you.
Thank you. Now I lost track. Supervisor Chimides, followed by Supervisor Mussman.
Hi. So when you go on the county department website, it brings you to the CDMS website with testing sites in Columbia County. but I know people who've gotten tests, who've got vaccination sites in Columbia County. I know people who've gotten vaccinations in Greene County and Albany County. They're leaving the county to get vaccinations. Is there a way where we can share that information? Because Albany right now, you can sign up, as far as I can tell, in Albany. It's it's a month or it's like a long way away, but you can sign up you can make an appointment in Albany for a month from now. So is there a way for us to share with residents how they can look at other county vaccination sites to be able to sign up?
I know that on the state website, they're supposedly, and I think they're kind of building this thing out, but on the state website, they're supposed to be listing all of you can go in, when you go in CDMS, you say, I want a vaccination site within 25 miles of my home. And then they're going to give you, that information. So that's on the state website. It's been hard to monitor. I think Greene County is doing a pod tomorrow. But it's been hard to monitor what's going on around us. I will tell you that we got 300 this week. Albany County only got 800, considerably, really not, probably no more than we did considering their population or whatever. The mass vaccination site at SUNY Albany, which you can sign up for through the state website, is got 10,000 doses this week, which sounds like a lot, but it really isn't for a whole capital region. And I know people have been going on there in the last couple of days and getting appointments in March, like you say. We're not going to book out that far. We're just not going to do that. So
So my specific request is, can we get that information and share it? So I have constituents that are talking to me saying, hey, I'm signing up in Albany. This is how I did it. And I'm seeing people on Facebook like having these conversations. That seems like a useful tool. If you can book in Albany, is that the kind of thing that we could share?
We have already put the state
Yeah.
hotline phone number. It's under the link on the website. I think to do any more than that is going to be very confusing. It's already confusing, and I think if we advertise for other counties, other locations, it's just going to be way too confusing. There are links on the website now, like I said, for the New York State site. And if you go there, you can actually go through that process, and it'll give you site locations in the Capital District area that you can sign up for, or you can call the New York State hotline number. Both of those are on the site, on the one page. But frankly, I would be against that. I think it's confusing enough already. And if we were to start advertising other locations, not knowing whether they're actually going to do it or what their process is, it's going to be way too confusing.
And in the call center, we are giving out the information as an alternative for the New York State website with the New York State phone number for people to call. And frankly, a lot of them, probably 80% of the people that have called said they already tried it, and it's out to March and April. So, and they have signed up for those appointments. They're just checking to see if they can get something sooner in Columbia County. So the people are quite aware of what's out there. And I have a feeling there's going to be a lot of double booking between the state and different counties and everything too.
Okay, thanks. I think in general, I think that I know things are moving so fast and they're changing really rapidly. So I think that makes it hard for us or for the Department of Health and the county to communicate what's going on. But I also think what I'm seeing from people is that whenever these changes happen, I think it stresses us out because we have to sort of get ready for the new normal. And I feel like I see people get stressed out too, where they're trying to find out what's going on. And I think that, to sort of Jeannie's point previously, anything that we can do to sort of to give more information, to simplify it. And I think like looking at the vaccine information stuff, there's a lot of really good information, but it might benefit from having something that's a little bit more of an instruction list. Like, number one, check if you're eligible by going here. Number two, just like some kind of like more simple instruction manual that's not so text-based, I think would be helpful. And then like, here's all the information below that. And I guess to my point around if there's other locations, I guess it is in there, but it's hard to see, is to say, check other locations, call this number, for other locations outside the county, call this number, just to kind of simplify what are the actions that people can take I feel like that's what I keep on seeing is people are like, what do I do? What do I do? What do I do? And so I think if we can simplify that, that would be really helpful. And I think attached to that, Tristria's point around publishing how many vaccinations we've given, I think will also help people, you know, as of Friday, we've given 1,200 or whatever that number is. I think that'll, even if they haven't gotten one, I think that'll help them see that progress is being made and that sort of like they're not, like the county isn't being skipped.
Okay. Thank you. What I will say, and I think the information flow will get better, but I will say that even as of today, the information was still changing. And that's what makes it difficult to put out a document when it's continually changing. But like I said, as this thing, we work through this process and the state works through the process, hopefully, you know, the information will be a little more settled and then we can put some more information out that'll help people. Supervisor Mussman.
Thank you. I just want to make a comment about your criticism of the governor and the confusion and chaos around the distribution of this vaccine. I would just like to remind everybody that the federal government and President Trump has had a lot to do with this chaos and mess. And just to defend the state and the governor, I think the Defense of Production Act, if it had been put into place, we wouldn't be in this mess. So just defending some of how things go. I don't think the state is the only person at fault here. I mean, how many the delivery is, the reason we don't know is because I think the state doesn't know. Right, Jack?
I would
Wouldn't
say,
you say?
true. I mean, I think that well, I think it's been made clear in the media that the feds have botched the delivery out to the states.
So that just to defend my side of the table.
There's no defense necessary, and I'm not.
All right, just
no,
want to, you know, hey, that's my job. I'm a Democrat.
I don't want to get into it tonight, but the fact is the state is responsible for distribution of what they have, and that distribution changed a few times, and that was my frustration, and also just and I'll leave it at that. Our health department was getting waylaid and hammered by the public regarding the fact that they weren't able to respond. And it's not just our health department, it was every health department in the state. And I wanted to defend our health department. It wasn't them. It had nothing to do with the local health departments. It was the distribution and the fact that they changed the rules 3 times and over a weekend frustrated the heck out of me. And
yeah, I get that. I've been watching, you know, the other supervisors and the executives of the counties talk about the problems that are happening. So just to.
But there's plenty of blame to go around.
Absolutely. I mean, I run a business. It's very confusing. It changes every day. Just trying to figure out how to get the PPP money is another, you know, there's a lot of confusion. I think we're all in the same boat. So just my other
No, thank you.
My other comment is I would like to have a little more transparency if I could from this group that meets 3 times a week. Like I'm a supervisor. I really don't know a lot of that goes on, the businesses. I know it's touchy. You don't want to mention different businesses. But I think any information, whether the county closes down a whole department, I don't really know who that is or what happens. I think making sure that as many people know what's going on is better than not knowing, so that we can put pressure on more people. Let's get the masks on. Let's be more careful. Let's give the hospital a chance. Et cetera, et cetera. I know the meeting's going on. I don't want to belabor the point, but I do feel we need to know as much as we can know so we can be prepared to explain why this is such an emergency that we're in. Thanks.
Yep. Just the one answer in terms of closures of departments or buildings, I believe, Kelly, we've let all the supervisors know when we've done that. We've actually put it in the press. And through our press releases. Sometimes the press doesn't print our press releases, but we have we have let people know when we've had a building closure or a department closure.
Yeah,
So-
but sometimes after the fact.
Well, yeah, because sometimes it's, it's,
Okay.
it's hard to hit a moving target, and
I
it's
got it.
happening, it's happening real time.
I know, but I'm a supervisor. That's my confusion.
Who is next?
Thanks.
Supervisor Collins again?
Yeah, thank you. Rob had mentioned different manufacturers of the vaccine. Is there any chance that we're going to be given something different midstream? I know Pfizer, I think they have an ultra low storage temperature, and would that affect your distribution, Jack? I mean, the logistics of it?
Well, what the state's been doing with the Pfizer is distributing the Pfizer through large organizations that have the capacity to store that well. For instance, the SUNY Albany site is getting 100% Pfizer because they're able to handle it a little bit more easily. And the Moderna is obviously it's conventional freezer, conventional refrigerator for storage. And so as the other, of course, with the other vaccines that are being finalized and going for FDA approval, we're competing with the whole world on those. I know that the Oxford, for instance, the Oxford vaccine, which is available now, India is snatching up a lot of that vaccine. And so we're competing with the rest of the world on some of the other vaccines. But I do expect that we would be getting more vaccines from those other sources.
Thank you. And one other question. I mean, this may sound callous, but would it make people complacent, the promise of an in-home vaccination? I mean, should we adopt a policy of push it, pull it, or drag it into the, your pods, to get people vaccinated? Because, it's a long time to go with these, especially elderly and, immunocompromised people, with people delivering things to their homes, grandsons, granddaughters coming to visit. I mean, is it more of a priority to try to get them in, to get them vaccinated, than their own comfort, let's say? I hate to say that, but.
From my perspective, I would say yes. But there are probably going to be cases where people just cannot get out of their homes. But I would say if the preference would be for people to go to the pods to get vaccinated, or to CVS or Walgreens or whatever.
All right, thank you.
Do you agree with that?
I wanted to add to when the immunizations first came out, we thought we were going to get Pfizer because that was the only one that was available at the time. So we contracted to get dry ice so that we would be ready. And then we didn't get Pfizer, we got Moderna. So, that was actually better for us because we can handle it better. But we didn't know at that moment. But we were ready to take on Pfizer too, because everybody was buying dry ice, which was also a run to get a contract for that, which we had, but we didn't have to use Pfizer. So there you go.
Okay, Supervisor Adams, unless your hand is still up from before.
No, I just had two quick questions. And one is a follow-up to what Denal just asked, which is if vaccines were to switch midstream or mid-distribution, I'm assuming the second shot has to be the same vendor as the original shot. Is that correct?
Yes, that's correct.
Okay. And the other thing is, and I don't know if Rob is on the line, I was thinking as we were all discussing seniors, over half my town is over 65. So, but we do have a very active senior lunch program, which has obviously not been meeting since March. If we had volunteers, do you think it would be a violation of HIPAA to maybe set up a computer in the town hall for seniors to come in and register? Or do you think I'm opening the door to more trouble?
I don't think that would be prohibited if the people allowing you to assist them consented to it. If they needed the help and you're giving them the help, I think that's okay. They're not a medical provider, so to speak, so HIPAA is arguably whether it's applicable. So it's really an issue of if they need the help and they're willing to give your people that information, you should be able to assist them. The only thing I would advise you is to make sure that you're doing it with a controlled group of volunteers Because if there is a leak or a breach of their personal data, it's going to be the town's responsibility.
Okay. Thank you so much.
Thank you. Supervisor Guzzi.
Yes, Jack, I don't know if you were aware, but in Livingston, we have Apple Ice, which does have a lot of dry ice. So I'm just mentioning it to you if it gets to a point where you did need something. I did call them actually and check on that here a few days ago. So just wanted you to know that.
They're on our list.
Oh, okay, great. Thank you.
That it, Jim?
Yes, good job,
Okay.
guys.
Supervisor Hoatling.
I just quickly wanted to reiterate, because I got a text as we're meeting that people are still confused as to how to register. So I just want to reiterate that you need to check the county website on a regular basis, every day, multiple times a day, until a registration pod opens up, at which point you go through the link, you sign up for a day and time. Once it's full, that registration pod closes, and there will be another coming at some point. We don't know when, so you really have to be on top of checking that website every day. That is how you sign up. And I just want to be clear with all the back and forth. It seems there's still confusion, so.
Sounds like a good summation. Yes.
Thank
you. Okay. And Sherry?
Thank you. Just to reiterate about communication with your constituents, if you could definitely reassure your people that they will get the vaccine, because that's one of the things that we've been doing at the call center. People are in a panic. Most people are very polite and thankful for the information once we give it to them. But people are very frustrated and they're very scared, especially the elderly people. So if you as supervisors, one of the things that would be beneficial, like Jean and Tistria both said, and in explaining to people that they will get vaccinated, explain the website to them once we get the fact sheet printed up. I think that would be a great thing to have available. Maybe post it on your website once that's done. And that might help get the word out to people to just be calm that they will get eventually vaccinated. And that would be very helpful.
Thank you. David Harrison, got your hand up.
Yeah, I just want to say that, right now we're in the situation that we're in, and everything we do depends on the number of doses we get and when we get it and all that. But, when this situation changes, and if we do get a large number of doses, like Jack said, we're going to let you know, and we're going to put it out in the media, and we're going to put it out on every social media site that we can. Go to the site. We have a lot of doses. There's open slots. So we're just stuck in this situation right now of you got to keep checking. My hopes are that doesn't last too long, and when it changes, we're going to make sure everybody knows about it.
Thanks. Thank you, Dave. Supervisor Leader, you have your hand up?
Yes, I do. Just a quick question. Jack, you said something about you hopefully will see it in pharmacy soon. And also when they do the call center and they don't have a computer, where do we go from there? That was one of my issues. If they can't, do you do it for them? I was wondering about that.
I have spoken to Kevin McDonald about this, and if we get a name and a number, then folks at the Office for the Aging will help them walk through that process.
Excellent. And you said about pharmacies, or is that hopeful or?
It's the governor wants it that way, and I think that with the reserves being released, I don't think we're more than a week or two away from that. I think that it will. My guess is because the governor wants the pharmacies to have it, they'll have them. And no, I have no way of knowing how many doses they're liable to get. It'll probably start as a trickle, but I think that yes, I'm very hopeful that within the next couple of weeks that pharmacies will have it.
Yeah, Kevin was sharing with me today that CVS has gone to some places where there's a, you know, a housing facility or organization type thing. So, I see that that might be helpful. Also, our senior citizen homes or our nursing homes, how we doing on that? Are we going in there and giving them the vaccine? I mean, are they getting it?
CVS and Walgreens are under contract with the feds to do nursing homes and staff and residents. And we get reports when our nurses talk with the homes that is happening.
Oh, good.
I think I heard yesterday that Pine Haven is completely done, for instance. So
Okay.
that is happening.
Good. Good to hear. Thank you. Thank you, everybody, for everything.
Okay, I've got 6:27. We've been going probably an hour and a half. What I can promise you is that maybe down the road, we can do this again as things progress to give an update if it's okay with everyone. You know, and I'd just like to thank Jack and the Health Department for their hard work, and Dave Harrison and the Emergency Management Office for what they've done, and as well as, you know, Kelly and Sherry and the Board of Supervisors. You know, everybody's pitched in. We've redirected staff from different departments to do contact tracing, to do the call center, and a variety of other tasks. We've got our tourism department. Two of our tourism department are helping with you know, social messaging and the website. So we've redirected staff to meet the needs of this pandemic. So I just want to thank everyone who's worked on this, and I appreciate everything that Rob Lagonia and Sarah Sterling have done in terms of the co-chairs, and they've been a big help through this whole process. So thank you. And again, we'll do this again, you know, maybe in a month or two, and we'll continue to do updates. Jack, you sleeping in your office tonight?
I got a sleeping bag right under the desk here. It's very comfortable.
All right. Well, unless anybody
Good
else
night,
has
Jack.
anything else, thank you all.
Thanks, everyone. Have a good night.
Thank you
Thank you.
all.
You.